called empathy evoking component of it. And the second part, which is the biology of weight regulation, to see if one or another, we probably need both type of information to change bias, but we want to see which one of the two components of education make the biggest impact so that we can shape our future messages accordingly. With that said, I'd like to start the panel discussion and introduce the panelists. So if you please can come forward and take a seat on the stage here. So we have with us Dr. Marta Koch. She's editor-in-chief of the Lancet Diabetes and Endocrinology Journal. We have with us Professor Rachel Bartram, who's just has been so kind, despite obviously having today limited motility. She's come in person, and we appreciate that. Professor Bartram is currently Senior Vice President of International Medical Affairs at Eli Lilly, and she's also an honorary professor of obesity and diabetes and endocrinology at University College London, where she has been working for many years. We also have with us Sarah Lebrock, who is founder and director of All About Obesity, and Sarah will also represent the people with lived experience. So thank you for being with us. And then we have Tala Burki, just reached the stage. He's very brave because he's a freelance journalist, is going to represent the viewpoint of the media. And we had a few questions from people online that were just asking if there was any representative of the media who had the courage to join us today. So, well, thank you all for joining us. So I would say, why don't we do the following? We give you a little bit of free text, very short, for each of you to give your personal perspective, and then maybe we can discuss pragmatic approaches and solutions to this problem. Why don't we start with Sarah? You heard we had an excellent presentation by Vicky. What you would like to add about this issue from your own personal experience?
Thank you, and nice to see you all here, and thank you, Vicky, following on from Vicky's hard, so I will do my best. But to provide, I think, from someone that lives with obesity, so to kind of bring my own perspective, what I find frustrating, I think, is that there's lots of exciting things happening in the world of obesity right now, and I just get frustrated that things aren't happening like they should because of the stigma that is still there. So patients are still not getting access to treatment that is now available. So historically, it was like we didn't have it. So that was the excuse. But now we have it. And the excuse now is who's going to fund it? And how are we going to prescribe this? And who do we start with first? And there's so many things. And I just look and think, what other chronic condition would you see this happening with? I sit in ICS conversations a lot at the moment, and I'm sat there going, if this was cancer, we wouldn't be having these conversations. So why are we doing it for obesity? So for me, that's my biggest frustration, is that it's stopping things from happening like they should do. We're not getting treated the same as other people with chronic conditions. And so I'd really like to see people understand, and I think it comes down to fundamentally as to how do we change this, is that people need to understand that obesity is a disease. And I think that's where we need to start, and we are doing that in lots of ways. But obesity is quite like an echo chamber as well. So there's some great people that are very engaged in obesity, and it's amazing. We see them all the time, and I'm so grateful for these people. But we need to be broadening that conversation out into society, because until society, until the media, until the government start appreciating that obesity is a disease and start recognizing it, we're not going to start shifting that needle with regards to obesity stigma and start removing that. So for me, it's about broadening that conversation outside of where we are and start getting more and more people engaged in the fact that obesity is a disease.
On that note, may I actually ask you a question about what do you think about this perspective that other people with obesity, and also some healthcare providers have, where they push back and say, well, obesity is not a disease. You can be healthy at any level of obesity whatsoever. So, what do you think is their point of view, and how would you answer their criticism, their concern?
Yeah, I understand why people feel that way, but I think what we need to stop doing is associating weight and health all the time, because we know that you can be healthier living in a larger body. No one's taking that away. But what we do need to always remember is that having excess adipose tissue is putting your body in an inflamed state, which is then going to make sure, or could, you know, enable other kind of disease states to come in and be more prone to getting other kind of infections, et cetera, et cetera. So we can't come away from the science and the evidence that's there. And I think that's what I always push back is it doesn't mean you're going to, but it means you're in at increased risk of. So I think we need to focus around people living the healthiest versions of themselves and not fixating just on weight loss, because we know that people lose weight, but they also regain it. So it's about how can we create health in there and make sure that's the focus rather than weight all the time, is what I would say.
Okay. Marta, your perspective, you have a vantage point as an editor of a leading journal on the subject, indeed, of obesity. What is your take on the problem of how big is this problem, and what is your opinion about it?
Yeah, thanks, Francesco, and hi, everyone. It's such a pleasure being here. So as the editor of a medical journal at The Lancet, we see, of course, that the issue of stigma is very pervasive. We feel like we are active players to counteract this stigma. I wanted to say as well that we do see progress. You know, once I look 10 years ago, when the Lancet Diabetes Endocrinology has been launched, we did use language that at that time seemed all right. It wasn't all right, but, you know, and we have published articles that use stigmatized language, but we have, you know, acknowledged that fact and also trying really to do better. And I think we want to promote conversation. We talked a lot about education. What works, what doesn't work. What we try to do as journal editors when we are educating our authors and our reviewers is to do so with compassion and with kindness, because in our experience, when we point fingers and become accusatory, people become defensive and they don't want to engage. And so assuming that when people use stigmatizing language, most of the time, they don't do it deliberately. They do it because they don't know better, because they have an unconscious, you know, could say an unconscious bias. But assuming that most people are wanting to be part of this conversation. We at Lancet have a language, inclusive language group, which we are revisiting all the time. And I think it's really important to appreciate that this is an ongoing conversation. It's not like we're defining, okay, this is the language that we have to use, let's move on. No, things keep evolving. And of course, including people with lived experience and asking them, what do they want? What do they need? How do they want to be addressed? And this is different from people living with obesity or people living with other conditions. You know, in the autism field, there's very much this conversation about whether people want to be, want the label as being autistic or not. So I think it's an open and ongoing conversation, and it should continue that way.
Thank you. Rachel, you have done much work about obesity in general, but stigma as well, and you have also looked at other aspects, other type, you know, the broader impact of weight bias in the healthcare, in the NHS, for instance. Can you articulate some practical examples of that shows how our healthcare system is almost blind to people with obesity? When they come to our hospitals, they find all sort of barriers. And can you just make a few examples?
I'd like to say thank you for inviting me to be here today, and thank you for really being here. Obesity is a chronic disease that seriously impacts on people's lives, and we know leads to premature death, but it's not diagnosed. Most of people who go to hospital who live with obesity, they will go for something else, and nobody diagnoses their obesity. They don't then refer them because it's not diagnosed, it's ignored. Then if they are diagnosed, they don't receive the care that they need, and in part because there aren't policies and enough research in the obesity area. But if we come back to healthcare professionals, people who go into healthcare actually go into it to help people. So I don't think they go in thinking, actually, I'm not going to be compassionate to that person living with obesity. It's because they don't understand. And I think this is where mandatory education across every single healthcare organisation really needs to come. Yearly mandatory training. We do it for other things. We do it for safe lifting, we do it for fire extinguishers, we do it for lots of things. And I think that if we give information, like you've just presented, that obesity is a disease and it impacts, and there's a complex biology, and I think it's an injustice not to treat people living with the disease of obesity. And if we give the information, I've never met anybody who, once you've spoken to them about the biology, how difficult it is for people to lose weight, and this is a biological disease, not self-will or discipline, then they change their mind. So I think it is really critical, as Adrian said, all dietitians need to have education. Every doctor needs to have education. And all those 100 professional organisations that signed the pledge, what have they done? So I think pledging is one thing, but what we really need to do now is action, real action, not just words.
Absolutely, and I think that's exactly the point of this discussion today, how we take actions and what kind of actions are realistically feasible and impactful. I'd like to go back to our media representative, Tala. You might, I don't know if you were here, Stuart Flint has presented some data about how pervasive is weight bias in media stories and not just bias and overt stigma and languages and figures, etc. One of the questions that we were having is that obviously we're discussing training for healthcare professionals, and we're saying that should be mandatory because we can't deal with people with obesity without knowing obesity and everything. The question is there any mechanism at all, not to enforce, but to encourage accuracy, maybe through training, to media, to reporters, etc. Because we see a disconnect very often between what is the scientific evidence and what is reported. And how we reach out to your colleagues, is there a mechanism? Is there an organization? Is there something that we can talk to?
Am I near enough to the microphone? I think this is tricky. I mean, I predominantly write for the scientific press. So people are, there's a certain rhetoric you follow that's set down by the journal. If we're talking about the mass media, it's not immediately obvious to me how easy it is to distill arguments like the ones that are presented here, given some of the sort of what's driving these stories. A lot of the stories, the purpose perhaps isn't to inform. The purpose is to kind of create a bit of a storm. Today, I was in preparation for this. I looked on the Daily Mail website, for example, and there's a faux debate they've set up there about whether people with obesity should pay twice for airplane seats. Now, it's not obvious to me how saying use the language people with obesity when writing this article is going to make a substantial difference. So, there's also a kind of issue about addressing the kind of prejudices and kind of drivers of the mass media press, tabloid press. Which is not to say it can't be done, because there were things that they were happy to say 40 years ago that, when I was at school, were acceptable statements that are completely beyond the pale now. And that's, that's across, across left and right, across mass media and kind of specialist journals and, The Guardian and whatever other well-meaning kind of publications are around.
So in terms of, you mentioned about language as well. So there's an effort to encourage use of people first language, to say that people should not be defined by an adjective, but the adjective should be just a complement, but the person is a person. So this now is becoming more common. Can I have just a quick take from each of you, whether you think encouraging use of people first language has a practical impact? How far can it go, and how far is going in your own industry, so in your own domain? So are you seeing this being used more often in the media, in scientific journals, in talking to people with obesity and also in academia and healthcare. Just let's go from Taleb backwards.
I think it's important. I think it's important to to set a framework here, terms that are inclusive and non-stigmatizing. Let's talk about it in these terms and leave these other ones kind of beyond the discussion, beyond the pale. I think that's valuable because it frames the stories.
Yeah, I mean, I agree. I think it's absolutely critical, but whether it's enough, I don't think it is. I think, back to the point that Tal was making, using this language to dress up other stigmatizing comments is something that we at The Lancet would, would pick on and would want to really avoid.
Mm-hmm.
Yeah, I think it's a really important step forward because you're recognizing the person and not just the condition. You're not kind of labeling them with their condition because they are a human being. At the end of the day, they just have a condition. So I think it's important that we start doing that and separating the two. I think what we need, though, and kind of in line with what the other two have just said around, is it's not just about the language. We've got to think about the imagery. We also need to think about the content, like you say, around, they might be using people's first language, but they're still sensationalizing something by saying about the topic of buying 2 airplane seats, for example. And I mean, I'm debating tomorrow about whether you should weigh patients before they go on not patients, people living with obesity before they go on an aeroplane. So that's a big conversation that's happening, and it's kind of like, why are we even discussing these things? But we are, and so I think it's about changing that as well and stop sensationalizing things. So yeah.
Rachel, there in letters from doctors to GPs, even specialists in obesity, sometimes we see people with super obesity or morbid obesity or these kind of things. Do you have any comment about that?
Yeah, language really matters here. And I think we need to call out when especially within healthcare, when those sort of terms are being used. But again, it comes down to education. Because again, often when you say, look, you wouldn't say a cancerous person, then people suddenly say, I see what you mean. And I think it's because this is not being called out and they've not been taught it, that's why it creeps in. But I think it's really important that we think about what legislation do we need here. So you're saying that there are things in the 80s that could happen in the journals, in newspapers that you can't do now. And I don't think we're going to move the needle unless we start with some tougher actions in terms of obesity being a protective characteristic.
Talking about tougher action, so that's exactly how we move from, of course, encouraging language and respect, which is one would expect that's the bare minimum, to something more incisive, like something that can really make a dent into the problem. So if we have to start from you, in the academia, what would you propose as a practical action for medical students, or even postgraduate? Is there anything that can be done to improve education, and in which way?
So I think it needs to be education, not just starting in universities. I think we should start with children at school, because we saw the data that 3-year-olds, maybe we need television programs, maybe we need Chris Van Tulliken to do something on Operation Ouch, or something that starts to explain to children that actually this is not the person's fault. So it needs to go across school education. We teach about healthy food at school. We need it in universities. We need it in employment. So right across everywhere, and also from the media, to simple bite-sized bits that obesity is a disease and that we need to be treating people with obesity.
The problem also is of course, we don't have, each of us individually don't have influence on every other domain, but we might influence our own workplace. So for instance, for us who work in universities or in hospitals, is there something that you could see as a practical step we can take and maybe enforce if necessary?
So when you had the first pledge that came out in 2020, UCLH signed up to it, and they did put something out to all staff, but it has to be repeated. So it has to be repeated training and education yearly to everybody, because staff turnover. Yeah. And I think it needs to be mandated.
And if I can push a little bit more, do you think there is scope for potentially considering some form of not punishment, but some form of responsibility for healthcare professionals that go on in public or with patients using not only stigmatizing language, but sometimes even promoting evidence-free remedies or talking about causality of obesity that have never had any justification in science, etc. How do you, I mean, I think nobody can say for cancer that there is an herb or another remedy that can cure the cancer and they should be given to, they cannot do with impunity. If you're a member of the public, you can do. But if you're a member of if you have a GMC registration, if you're a doctor, if you're clinicians, I don't think you can do that because you will have a reporting mechanism and you will probably face the consequence of it. What do you think could be done in this sense?
So I think it still needs to come back to education and actually having a proper definition of obesity when it's a disease, I think is a crucial foundation. And that's part of the problem, that all the argument about BMI, healthy obesity, I think it's confused and muddied the waters. So I think we first need to make sure, rather than sort of blaming people, I think we need to start with the education that actually when is obesity a risk factor, when is it a disease, and start from those basics. I think if we start with the stick without the education, then we just put people's backs up and we won't get anywhere. As I say, I think most people who go into healthcare genuinely want to help people, and they just need the right messaging that obesity is a disease. It's not a lifestyle choice.
Martha, what can an editor do? What can you do as a medical journal to facilitate a new narrative, if you wish?
I think, we can educate our authors and reviewers on the use of non-stigmatizing language and images, but, as we all said, that's limited. I think what's really powerful, and Vicky's story today really moved. It's really powerful to hear a personal account from someone living with obesity, and our journal has launched last year a number of formats where we offered the platform for people with lived experiences to talk about how they feel, what's important for them. And I think that's so much more powerful than me always telling my reviewers, oh, please don't use this, use that. And I find myself telling over and over again. And, when we go through multiple checks, copy editing stages, we correct the same things. And that's important and that's helpful, but the power of a narrative of someone who has experienced this stigma is so much more important.
Yeah, I'd like to echo that in many forums where I've spoken, the thing that makes the difference is the person with lived experience. But it's very hard sharing stories, and because of the backlash that people with lived experience then get, I think this is where we do need to have advocacy groups. And it's really hard even to get people to join advocacy groups because people don't complain. And I think just not thinking more globally, not just in the UK, and this is where Vicky leading ECPO across Europe and across the rest of the globe, we really need to help the advocacy groups to reach out to people who need support.
From the perspective of a person who lives with obesity, or maybe if you want also a patient, if you want, that comes to a hospital, sees a doctor, I think that people can put a lot of pressure on healthcare professionals, expecting and demanding that they have been treated with respect. Do you think because of intrinsic, bias that is affecting also people with obesity themselves, they probably patients and people let doctors and healthcare professions get away with a behavior that should not be condoned in any form or shape?
Yeah, absolutely. I've got my own experience of, and again, mine was linked to my pregnancy, which I can think of, was around that whole experience being kind of tarred with the whole, like, me not looking forward to having my scans because I was made to feel so awful every time that I did. And it was made to feel that they couldn't see my baby, and it was all because of my weight, not because maybe the baby was in the wrong place or all the other factors that can come into it. It was just purely down to my weight. And I know a lot of people, it's like they can't see beyond the body, and so therefore make these judgments about people. And that's what's frustrating, is that you need to see that this is a person in front of you and treat them the same way as you would any person with any size body, and start understanding why they're there rather than making an assumption or a judgment. And so I do think, and I think because we have this internalized stigma, I mean, I still do, even though I do talk about this all day, every day, I still feel like this is my fault. I still feel shame and blame, and I still that's my go-to when someone says something to me. I'm like, yeah, maybe that's right. So then you don't want to stand up and say and push back and go, excuse me, like, you really shouldn't be saying that, because you kind of feel like fundamentally you're like, yeah, I understand why they're saying that, or yeah, it probably is my fault. Or so there's a lot of that stopping those conversations, and just taking it outside of healthcare. Like, I was speaking to some politicians recently about kind of like how they can make a difference in Parliament and the government, and they were just saying, you know, an example was they get a lot of people in their constituencies writing in saying they can't get access to eating disorder treatments or services, for instance. But a couple of the MPs that were there said they've never had anybody write to them to tell them that they can't get access to support for living with obesity or obesity services. And I just was really shocked, because we hear that this is happening all the time, but we don't want to speak up about it, and we're not kind of making that step. And so for me, that was a real, well, that's quite not a simple thing, but it's a way that we need to start making more noise and feeling more confident to have those conversations. But it's like Rachel said, it's really hard because people have spent so long blaming and shaming themselves. To go past that is so hard, to suddenly feel like you have a value and that you should be doing that. And that's what we need to start doing with advocacy work, and it's empowering people to know you're a human being and you deserve the same treatment and care and standards as anybody else, and really empowering that message. And so that's kind of what I try and do. I know that's what Vicky tries to do, because that's what needs to start happening to move things forward.
Just a very practical advice from you. I've, and I think other colleagues have had the same experience. I've been trying to organize events like this about stigma of obesity, and I've been trying to invite, obviously, people from the healthcare system, and we got people speaking and people attending. When we tried to reach out to journalists, we were not as successful. It's very difficult to pin down somebody and say, can you come and listen, unless there is a news. You alluded to that. If there is a news, they will come and they will listen. But if you're saying we're going to try and inform you or have an educational event, they don't tend to come. Is there an organization, is there a mechanism where we could reach out and say, we want to create an educational opportunity for people who write, medical writers or general journalists, and this is an important topic because you read now, and even more now, you write a lot about this. It would be good if you do with accuracy. Is there any entity, anything? We can go to GMC and report our colleagues if they don't behave well, but we can do that with the media.
I'm not aware of a kind of network of that kind that exists, but it might be possible to do kind of tricky kind of linkages or bind it into other agendas. And there's something that in this issue of the Daily Mail I consulted this morning, a lot of articles there on hidden amounts of salt, on this ultra-processed food thing, which everybody is reading about now, and there doesn't seem to be a resistance to this idea that the food industry and this is basically social determinants of health, although it's not presented in that way in the press. So it could be perhaps linked with agendas which are kind of more in fashion or more kind of trending at the moment, things like the food environment and the socio-economic situation out there. Stigma itself, it's, messaging like you had with that animation, to find the right way to distill this to the general public, because I write for the scientific press, people are more open to, complicated, slightly lengthy articles. That's not the right messaging, obviously, if you're presenting something in a 400-page feature for, on the internet or whatever. So that needs to be honed a little bit, I think. But I mean, if you get the messaging right, then people will come.
In fact, that's exactly what we're trying to do with this program. We had this publication from the consensus conferences,
Yes.
about 15, 20 pages of single line written, 100 or 200 references. And obviously, probably nobody reads it. Certainly not in the general public, not in the media. But
Yeah.
you know, even in our field, probably not everybody reads through the whole thing. So you suggested a message has to be simplified.
Yeah, I think simplifying messages and linking agendas, but it's curious that there would be a lack of interest because I think, as was just mentioned, we're talking about potentially the majority of the population could be stigmatized in this way. So it's odd that it hasn't gained more traction because of this. Unrelated, but I wrote on the opioid epidemic in America, and this attitudes to that started changing when everyone knew someone who was addicted to fentanyl or whatever, that this was suddenly an immediate concern in their lives. So I find it odd that that connection hasn't yet been made, but one would assume it will be, or hope, let's say it will be, yes.
So in terms of, again, practicalities, etc., we want to educate, and obviously the message has to be packaged, but the question is also packaged properly depending on the stakeholder you speak with, especially for the public. We have to understand that nobody's going to read or very long pieces of scientific articles. But the question is also, what should go into that education? Should we educate people about how bad it is to be on the receiving end of stigma? For instance, what Sarah and Vicky are telling us, that is very powerful as a message. Do you think that that would make an impact on the public? Or should we explain what Professor Kaplan was saying, that obesity, and Professor Batran said that obesity is a disease, and maybe even why weight is not regulated as just energy out, some sort of biological easy explanation would make an impact. What is we're going to try to do research on this, but what is your anticipation? What do you think is going to have the biggest impact? Evoking empathy, explaining disease and biology.
Well, I think it's both. The disease thesis is important. And I think also important, I don't know whether this message is out there that, stigma isn't just cruel. If the purpose is to foster an environment where people have better outcomes, then stigma actively legislates against that. And I don't know whether this message is out there, whether the public, whether people know that, basically, that, it's not just mental health issues, it's your physical outcomes are worse. That should, I think, be disseminated as, it's not the primary reason perhaps to decrease stigma, but it's a key one. And then perhaps linking as well with mental health. That's was stigmatized, in my lifetime, mental health concerns. It's a totally different playing field now. So a linkage there is also possible, I think.
Yeah, that's a good point, and maybe gets back to the idea of explaining obesity as a disease. Depression has been for many years misunderstood by the public. Today, there is an understanding, even among the public, that there is depressed mood and there is clinical depression. I think even the population at large understands and grasps that difference between, and probably they would appreciate that you can't just cheer up somebody who has clinical depression and expect that that's going to do the trick. So do you think that, all of you, do you think that in this sense, explaining obesity as a disease could have the same impact that explaining clinical depression has had in the past in mental health?
Yeah, absolutely. I think the narrative and getting that across to everybody, public, policymakers, healthcare professionals, that is the fundamental bit that we need to do in order to really try sort of change it. But we do need the person with lived experience. You need the both. And also that actually stigma is detrimental to somebody's physical, psychological health, and also it stops them from seeking care for other serious medical conditions.
Yeah. No, I totally agree with that. And I think that the phrase that I use a lot and makes people kind of gasp, and I get a lot of pushback on, is obesity is not a choice. And we need to keep saying that. Because right now, society thinks people choose to live with obesity. We don't. I'd really not like to live with obesity. And I think more people need to realize that there are so many factors that are out of someone's control that mean that they are. So it's not just that it's a disease, but it's kind of like, actually, it's a disease that people don't choose to get as well. I think that's really important. And I think just going back to the kind of the effect of weight stigma is that there's still this mentality that because people think it's a choice, that they think we can be shamed to not live with obesity. And it's kind of like, no, like, and the evidence shows us that that's more detrimental to someone's health than actually living with obesity itself. So we need to start changing those conversations and coming out with those kind of, it's not a choice and we can't shame people to not live with a disease. And I think that for me are fundamentally two of the main things we need to focus on.
Can I make another point? So in your introduction, Francesca, you mentioned we don't have a cure, and we don't. And we don't understand a lot about obesity. But if you look at the amount of funding that goes into research into obesity, the drivers, and looking at the biology, compared to other disease areas, it's woeful. Yeah. So again, I think actually the stigma to do with obesity is actually also impacts on how much research funding is allocated to it. And if we are going to find a cure, then we need to be thinking differently.
I think there's of the research is an aspect that sometimes and very often is not brought up when we talk about the impact of stigma more broadly, but it's equally damaging and massively damaging, because if you do have this narrative that says obesity is easily explained by eating too much, exercising too little, there is not even a need to search for the causes of obesity. So not surprisingly, in 40 years, we haven't made any advance in understanding where it's coming from. Where an epidemic of this magnitude that has never hit humanity before, for the magnitude of this epidemic, where is it coming from? Is it possible that it's only because we all became sedentary, we all are eating more, etc.? Obviously, that's not an explanation. But the research is not just a matter of lack of funding. It's probably also a misleading in which direction. I think government-based research is limited in funding, obviously. And when you compete for limited funding, sometimes many researchers go for the safe way. They say, well, this is what probably is going to get me the grant. If I challenge the status quo, it's unlikely that I'm going to get funded. So don't underestimate the impact of bias and around obesity in research as well. I think your point is very well taken. Marta, you were talking about making the narrative more accurate and telling people that obesity can be a disease, if not a disease. And I want to, if I can, I think we have published the announcement, so it's public knowledge. Your journal has sponsored this commission that is important, and I think it's going to make a hopefully good contribution, because it's going to try to explain exactly why and when, and if and why and when obesity is a disease or not, and maybe come up with a new definition of obesity altogether. Because probably the one we have may be the reason why it's not accepted as such, because we can actually say something, but if we don't persuade people, we don't go very far. What do you think is the responsibility, if we have as medical community so far, for not having made the point strong enough that this is a disease, at least in some circumstances?
Well, that's excuse me, that's a tough one, Francesco, isn't it? Yeah. I mean, I don't think we want to persuade people. We want to give them strong evidence, strong research, so they don't feel they need to be persuaded and they can make up their own minds. I mean, the issue of obesity is a very, very complex one. And, we at Lancet will challenge narratives that come in with this idea that it's a lifestyle choice, or there is a choice at all. I think other fields, thinking mental health, and Francesca, you mentioned depression, and those fields have been very active in discussing these issues, whereas in obesity, perhaps we're all still lagging behind, and with a lot of hope, research, collaboration, such as, the Commission, hopefully we will get there, but not by persuading people, I think, but providing them really strong evidence that they are convinced.
Yeah, I mean, for persuading, I didn't mean to sell a concept. What I meant is that the evidence is strong, it's there, has been there for a while. The problem is that people don't take notice of this. And so persuading people in the sense of explaining the evidence, or maybe putting it together in a way unlike has been done so far, that is more rational and more meaningful. So in that sense, I meant persuading.
No, I got that, Francesco. But I think, like Sarah was saying, there's so much internalized stigma still, and that's something that we all have to consider as well. And so do we feel actually that we have to persuade people? Maybe somehow we feel that way? I don't know, I'm just putting the question out there.
Well, the thing is that a lot of people within the medical community disagree with the idea that obesity is a disease. And I think when the public sees a fraction medical field on a topic of this, apparently this would be something like almost black and white. Diabetes is either a disease or not a disease, a cancer. So how people would say, how did the healthcare, the scientists haven't figured this out? And if they haven't, then maybe I'm not going to buy one opinion versus another. It's just opinions. You say evidence. I think the evidence probably is there, but we haven't perhaps put it together in a coherent narrative. And that's what's probably creating damage within and outside the medical community. Stephanie, I don't know if you're seeing any question from the people online. If you do, please let me know so we can use those as well.
Someone, please. Yeah. We've got one here. How do you think the National Child Measurement Programme impacts stigma of children and how they feel about themselves being labelled at that age? But then, in contrast, it was also mentioning that we need to be careful with the language of children because they will get teased potentially if we start saying they have a disease.
Who wants to take that?
Yeah, this is quite topical actually, because my daughter's in reception and I literally have just got this letter to tell me she's about to go through this. And I kind of got it and I was like, oh gosh. But I actually want to see how this is handled because I've read about it, I've heard about it, I know it's been researched a lot, but I really want to see that my daughter doesn't live with obesity, she's very tall for her age, and so she probably is heavier than a lot of her class. So it will be interesting to see what letter I get home and to see how it is handled. And I'm kind of, intrigued to see because I think it is making me a little bit unnerved because I kind of go, well, how do I then manage this and what's that going to look like? But yeah, I think it's a really interesting one because I think lots of parents suddenly they feel shame and blame because they're suddenly like, oh my goodness, you're telling me my child is, overweight or living with obesity. So, what have I done wrong? Like, why? I'm obviously doing something wrong. And it's kind of like, no, like fundamentally, like, children all develop at different ages and different times and in different ways and I think it's really, I know the argument is we've got to have some sort of measurement and we're doing it in reception and then we do it in year 6 and it's a let's keep an eye on things, but do we really need to see that information as a parent coming back to us? Do we really need to be doing it in this way? So I do question if sometimes we need to push back and kind of go, could we do this differently? Is this the right thing to do? Because I do think it ends up causing a lot of unnecessary anxiety, mental health problems, starts children with eating disorders or kind of disordered thinking around food. And we really need to be mindful of that. And I don't think enough thought goes into that. Because having a 4-year-old, she already talks about, is that healthy, mummy, or is that this, and I'm just like, gosh, just enjoy your life, like you're a child, but I think it's already kind of putting too much pressure on children to think about their bodies and how they're different, and I know for myself, like I developed a lot earlier than a lot of my friends, so ultimately felt different, but in a negative way. I felt like it was bad that I suddenly had boobs when my friends didn't and all of that kind of stuff. And I think we just need to be more open to discussing that people come in different shapes and sizes and that's okay. And getting that narrative across rather than this whole, like, if you don't look like this or act like this, then it's wrong. So I think, we've got to think about how we frame these things. I think it's really important.
Yeah, I think, the issue of diagnosis also in other areas is a very controversial one. There's pros and there's cons to diagnosis. And what I think is really important to think about is a diagnosis going to be helpful to this person? Is it going to improve access to healthcare, or is it going to create anxiety? And again, everyone is different, and perhaps really, actually not perhaps, just really including people who have, the lived experience or the parents, if we're talking about a child, and asking, what do you think will be most beneficial? Some people are looking for a diagnosis, and that diagnosis is helpful. That label is helpful. Some people, with say other fields, ADHD or autism, find that label helpful, and others don't. And how do a person with obesity feel being labeled?
Well, I was just reading this note about a question from online audience. The online audience says, related to the point you were making and my point, any thought about whether obesity fits on a continuum with a disease, or there is some sort of cutoff, some sort of mechanism to distinguish? I think we cannot anticipate the conclusions of the commission, but I think that's exactly the point that we're making. One of the points we will try to explain is that obviously when we as physicians and scientists say obesity is a disease, of course most of us do it with the good intent of saying this is in the best interest of patients. But also one of the responsibilities we have is to realize that giving a diagnosis to somebody has a major impact, psychological, physical, of all sorts. When somebody goes to see a doctor and is told you have a chronic disease that could possibly reduce your life expectancy, etc., that changes their life. They go back home, they are concerned about their income, their future, their children and grandchildren and everything. It's going to be a constant thought in their mind. So what I think we have as a responsibility is that we have to walk that fine line where we make sure that we recognize the disease when there is, but make sure we don't overdiagnose it, because that would be damaging to the people we want to defend. And if you make a diagnosis of a chronic disease to somebody who doesn't have it, imagine giving a diagnosis of cancer to somebody who doesn't have it. That's as damaging as almost as having the disease itself. So it's a really difficult line to walk, and we hope that we have find a way to address this. It was a very 2 years of work. And it was a very difficult topic. You will read more about this when it comes out, I hope soon. So there's a question from the audience.
More of a comment. I just think, so I work for Diabetes UK, and we're grappling with stigma, and listening to these conversations, I think there's so much for us to learn from each other and work together in this space. And so much parallels, type 2 and obesity. And just kind of comment I want to make about disease, type 2 diabetes is obviously recognised as a disease. We are still very much dealing with the same issues here, for very same reasons that Sarah was talking about. We need to challenge the narrative that obesity and type 2 diabetes are a choice. We've got excellent scientific evidence to show strong polygenetic drivers of obesity and type 2, social factors, biological factors, that people are fighting against their biology. So for me, it's about challenging that personal individual responsibility narrative, and simplifying it. We don't need to go into the ins and out of every risk factor for the conditions. We need people to shift their mindsets away from blame, and that, I think, we've just got great science to show that, people, if they were up to speed and we close that gap of knowledge, that we could shift public opinion. I really do think we can do that together. So yeah, really would love further conversations with people in the room about that.
I'd add to that, the public are open to discussions recently, sugar, the effect that sugar has on the body. I mean, this was something that the press wrote about a lot, and people were very happy to hear about the kind of physiological impact of sugar. And then more recently with ultra-processed foods, there's been a slew of books about them, which gets a lot of play in the media. So it's not, there is an appetite for these kind of discussions, I think, in the general public. It doesn't have to be simplified to the extent that, science is excluded, because people do want to hear about this, and, that does help modify opinions.
So now, yes. Okay.
All right, just it fits in with that one. So someone's here sort of saying, how do we find the balance between over-medicalising a disease that's largely caused by our social environment? And I guess there's also another comment here which would be interesting, I think maybe for Rachel, is trying to find the balance, and also what's your role with obviously is there a conflict of interest?
So I've spent the last 25 years in the obesity field, and I'm here for that aspect, and I'm not making any comments about anything to do with specific treatments. The aim here is to do with stigma, and in no other disease area is it acceptable to stigmatize a person. And I think that's the key messaging, and the biology, and I've spent a lot of time working on the biology, and I'm here to represent that, and I'm not talking about anything to do with pharmacotherapy.
Yes, in fact, I think I want to emphasize that we have not been talking about treatments, neither specifically nor very much in general, other than saying, which I think is objective, and you don't have to be really a rocket scientist, that people with obesity have no access to care. We just treat not even scratch the tip of the iceberg. The majority of people just get denied, and this is unfair. This is a discrimination, and I think at that point we can defend that from any allegation of conflict or whatever. This is reality. This is objective. This is science. One of the things on this line of thought is that there seems to be a tendency to think that everybody can have a say about obesity. Is obesity a disease? And you have politicians weighing in on the topic. Is obesity, should it be treated or should it not be treated? And you see people on social media or members of the public, et cetera, et cetera. You don't see the same type of discussion occurring with cancer. I just made an example, even in the worst case scenario, which has been the COVID pandemic, where everybody had a lot of emotions around it. The communication that the pneumonia was due to a virus came from the healthcare community, from the scientists. And people do not question that there is a virus behind COVID. If we, as a healthcare community, say obesity is not just you eat too much, you still get pushed back by people outside the medical community, like if they know and they are entitled to have a say on this. So how you fit the balance, I mean, create a balance here between, obviously we don't want to preach, but do still the job that we are supposed to do as medical community, being clear about what the evidence is and make sure we can defend it and explain it. Because otherwise we're going to have politicians who have no clue about what obesity is, or the public pushing back on things that could hurt patients, people who are suffering, etc., because they don't get access simply because it's not a popular topic, or governments cannot make incisive actions because the poll of opinion would already tell them that there will be no public support if they support treatment and so on and so forth. So what can be done to recover maybe the authority of the healthcare community on a matter of medicine that we think we probably we lost for years?
I was just going to make the comment that I think even having that question pitched in this room, like by somebody, is an example of stigma, I feel, because it's kind of like, why are we questioning the evidence that shows us that obesity is a disease in certain people, is having, biological effects on somebody's body? Why are we questioning whether that's medicalizing something? It's evidence, it's fact, it's science. So the fact that people are still pushing back, going, stop medicalizing something. We're medicalizing something that's medical.
Yes.
So, I think we need to really start digging into why we're asking these questions. Why are we putting blocks in the way? And why are we not just moving forward with how can we make a difference and how can we make a change? Because that's really frustrating, and it just shows the hurdles that are there. And in whatever environment, it's meant in a good way, I'm sure, but it just shows that it's so evident that people can't see past this stigma that's there. And it's just, I think.
Yeah, you pointed out medicalizing as got a derogatory meaning, whereas this medicalizing what is medical is the right thing to do, indeed. And the reason why we have a problem is that this has never been properly medically approached, explained, and characterized. As we are running out of time, why don't we do just a quick last message that you would have, whatever you want to say. Let's start from you on anything that you can practically suggest we should do going forward.
I just end on a note of optimism. I think there's no reason why, that this can't be done. As I alluded to earlier, we've seen some huge attitudinal shifts over the past 10, 20 years. And I think there's every reason to believe that could happen with obesity stigma.
Martha?
I think it's so important to communicate, and this is a great example of communication, and also the work that you're doing, Francesco, together with 60 fabulous other people. And obesity is a public health problem. Lack of empathy is a public health problem as well outside. And I think communicating with empathy and with kindness is what's going to make a big difference.
Sarah?
Yeah, and mine, I suppose, quite simple, is just to remember the people living behind the condition, because every person deserves to be treated the same. And that's what we should be remembering when it comes to obesity.
Rachel?
I don't know I can match that, what Sarah's just said, but I do think we need to do something different to really change where we are with obesity stigma. It's 5 years since we had that meeting in New York, and I don't really know that much has really moved on. So recognising obesity stigma, weight stigma is important, but we now need action so that people like Sarah, when they go for their scan, which should be an amazing moment in their life, don't completely feel shamed for something that's not their fault.
And on that note, I think that's a very important point, because we're all behind that pledge, but pledge is just a way to raise awareness and engage people. But at the end of the day, actions are the things that will change the situation. And we will encourage people who have attended this meeting, both online and in presence, to send us any suggestion you may have about how we take that pledge that many people signed, including many of you here, and we take it forward to actual changes and maybe do something, whether it's a petition to governments, parliaments, or if it's something else, whatever can be done, it should be done. I think it's time for action and no longer for just talking. I want to thank the panelists for their time, for their insights, and also the other speakers. And most importantly, each and every of you who have attended here in London and online. Apologies for some of the technical mishaps, but I hope you have enjoyed the workshop, and I hope that going home, each and every of you can think about weight bias maybe on a daily basis. When you see people who have obesity in front of you, just think about what we've discussed today. And if you can, think also what you can do individually in your own life, in your own working environment, because I want to conclude with a Chinese proverb that was told to me many years ago, and it states, if everybody cleans in front of their house, the entire world would be cleaner. So each and every of us can do something about it. No matter, whether it's a petition to a government or something as simple as challenging bias in the people in front of you, or maybe I should do the same with my colleagues who have, used the derogatory words for some of my patients, etc. So each of us can do something, and I hope this workshop has given you the even empowered your arguments to do that. Thank you very much, everybody.